Thank you for staying with us as we present this special, the Rebound Colorado Town Hall. I'm Denver 7's Ann Trujillo.
And I'm Elizabeth Watts with KOAA News 5 in Southern Colorado. Even as our state begins to rebound, we all want to stay safe and healthy.
We took your health questions to Colorado State Epidemiologist Rachel Herlihy.
Unfortunately, we know this virus is going to be with us for a very long period of time, and so because of that, we will be doing regular surveillance tracking this virus for weeks, months, probably even years to come. There is plenty that we don't know about this virus, and this is why part of the reason it's really important to be collecting this data is to really help us understand who is becoming most ill with this virus, what those risk factors might be as far as, underlying medical conditions that people might have, certain age groups. We certainly know that there have also been racial and ethnic disparities, and so that's really the type of data we're trying to collect and understand. Our goal is to, try and prevent a second wave, a large wave of cases from occurring. And what we're doing to try and manage the virus is really trying to allow for a low level of transmission to occur, but for that level of transmission to not exceed our healthcare capacity. We do know that the illness that this virus is causing is devastating, right? Particularly when you look at people with chronic underlying medical conditions and older adults, we are seeing really high rates of fatality among those individuals, and those most vulnerable individuals are really who we're trying to protect through the various disease control strategies we have in place, including social distancing right now. We have a lot to learn about this virus still, to learn about how it is transmitted, but one of the things that we do know about respiratory viruses in general is that they are spread through respiratory droplets. So that is when people sneeze or cough or even breathe deeply, potentially, that virus can be spread from person to person. And so much of what masks are doing is really containing those respiratory droplets for the wearer. So they're really protecting the people that are around the wearer from respiratory droplets. And with COVID-19, that's particularly important because we know that there's asymptomatic transmission of this virus. And so it's important for everyone to be wearing masks, even if you don't have symptoms, because we don't know who could potentially be transmitting this virus. There's best policies and best practices, and we certainly are looking to the research community and the federal government for their best guidance on the use of masks. But I think it is a low resource intervention, something that all Coloradans can do to protect members of their community that are most vulnerable. Masks are really going to be most effective if most Coloradans are wearing them most of the time, right? So that's really how we get the benefit from mask wearing, is if there's universal use of masks in the state. That's really how we protect the most vulnerable individuals among us, is if all of us take part in wearing a mask. But I would say the settings where it's really most important to be wearing a mask is certainly when you're going to be within 6 feet of someone. And obviously, so that means things like going to the grocery store or running errands. Those are absolutely the times you need to be wearing a mask. But we're also asking Coloradans to wear masks when they go for a walk or with their dog, because you are going to be contacting people, walking past individuals on the sidewalk, and so it's important to wear masks in those settings as well. There's obviously going to be things like going for a jog where you're breathing deeply and perhaps there's not a lot of other folks around, where it might be okay to take off that mask, and we're asking people to use their judgment there. And when a mask might interfere with their exercise or breathing, that's certainly a time to consider not wearing a mask. At this point, access to pools is continuing to be restricted under Safer at Home. But in the future, there certainly might be that possibility that pools would open later in the summer. I think that's still really to be determined. But what we do know about transmission of the virus is that there's likely not extensive transmission of the virus in pool water, and a pool that's appropriately managed. We don't think transmission is occurring through water. I think what would concern me more, though, is individuals crowding around a pool, being close to each other, interacting, playing. Those would be the types of behaviors I think that we'd be a little bit more nervous about, and the virus being spread from person to person in those types of pool settings. At this time, during this Safer at Home period, gyms continue to be closed. There are some limited exceptions for outdoor activities and personal training in outdoor settings. And again, it's really important in those settings that the groups are small and that social distancing is maintained, so spacing of individuals 6 feet from each other, no shared equipment, those types of things. Anytime that you have individuals interacting closer than 6 feet from one another, there is risk of transmission. And so I think that is something that individuals need to be aware of is that there is going to be risk of transmission in those types of settings. Cleaning absolutely and disinfection are critical strategies to be used to prevent transmission of this virus. We know the virus can survive on surfaces, and routine cleaning can rid those surfaces of the virus. Certainly more regular enhanced cleaning is important at this time, but there are also going to be scenarios, the setting of an outbreak in a workplace, for instance, where additional aggressive cleaning might be needed above and beyond what is being done right now. So again, I think cleaning and disinfection is a really important piece of the puzzle here for controlling transmission. And I would say cleaning should be heightened routinely now, and there might be need for additional cleaning measures in the setting of an outbreak or increased transmission in a given setting.
Thank you for joining us for this special, the Rebound Colorado Town Hall. I'm Elizabeth Watts with KOAA News 5.
And I'm Denver 7's Ann Trujillo. We hope you were able to get the answers to some of your biggest questions as we all navigate this new reality together.
And as a reminder, KOAA.com/rebound, a great place to find resources and read stories specifically about our state's recovery. And from all of us here at KOAA News 5 and Denver 7, we are working together to cover all of Colorado for you. Stay safe, stay healthy.